My name is Haley Laney, and I'm going to be demonstrating how to take blood pressure. Blood pressure is the amount of force that is placed on the arterial walls of the heart. Normal blood pressure is 120 over 80 or less. Hypertension is 140 over 90 or higher. This can cause heart attack, kidney failure, and stroke. And there are absolutely no symptoms for hypertension, so it's good to get your blood pressure checked pretty frequently. The first step is to remove all the clothing from the arm. And when you do this, you're going to want to make sure it's not too tight and it's not making any sort of tourniquet effect to the arm. So this is good. And then you're going to want to make sure that your patient's legs are uncrossed and that the arm is about the level of the heart. So this will be good on there. Then you're going to want to place the cuff on the arm, and you want it to be at least 2 fingers above the bend of the arm. And you want to put it on really secure, so you don't want it too tight, but you want it tight enough. Okay, you want to put the gauge where you can see it. Let me put it up here. And then I'm going to put these in my ear and feel for a brachial pulse, which is found in the brachial artery, which is found on the outside part of the elbow. Find it right here. And I put it right on top of it in here. So now I'm going to feel for a radial pulse, which is found here right below the thumb. And I'm going to use 2 fingers to find it. Alright, I can feel it right here. So now what I'm going to want to do is twist this valve till it's all the way tight to where no air can come out. And I'm going to put these in my ear and pump this up till I can no longer hear her pulse or feel her pulse. So I'm going to pump it up, and I can no longer hear it or feel it at 120. Then you're going to want to add 30 to that. So 120 plus 30 is 150. So I'll pump it up to 150. Then I'm going to place this back over that artery and let it out really slow. And I'm going to listen for the first beat. I can't hear a pulse right now, so I'm going to listen for the first pulse, and that'll be my top number, my systolic pressure. And then the last pulse I hear will be my diastolic pressure. So, okay. The first pulse I heard was at 120, and the last one I heard was at 60. So her blood pressure is, what did I say? 120 over 60, which is normal. And that's how you take a blood pressure.